The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to the County Health Rankings and Roadmaps Partnership Series webinar, Rallying Partners, Leveraging the Mobilizing Power of United Ways. This webinar is being recorded and will be posted on our site later this week. Karen Odegaard posted a link to the slides in the chat box, and we also sent a link to all participants before the webinar. My name is Jan O'Neill, and I'm a community coach with the County Health Roadmaps Project, and my colleague Karen is here with me today to help with questions and to help with interviewing during the webinar. After a brief overview of County Health Rankings and Roadmaps, our guest, Kate Sommerfeld, Area Director of the United Way of Greater Toledo, will share how they are using their role as conveners and coalition builders to help build a broad and diverse partnership and help them work in new ways to move policy, systems, and environmental change forward. Of course, this program wouldn't be here without the help contributions of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps.
We want to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. So on the left of your screen, you can see the viewer window. This is where you'll see our screen throughout the presentation. And on the right, you can see the control panel. This is where you can interact with us. We will be taking questions and any comments or insights that you want to share with us throughout the presentation in the control panel. So you'll see that over on the right-hand side. That's where you have a Q&A box, and you can feel free to enter your questions there at any time. Throughout the webinar, we will also be chatting out some relevant links, so you can watch for those in the control panel as well. So here's a quick outline of today's webinar. We're going to start with an overview of the County Health Rankings and Roadmaps for those of you who are new to our program and or site. But for those of you who are familiar with the program, I'm going to be posting some links so that you can explore a little bit during this part of our webinar. Next, we'll talk with Kate to find out how the United Way of Greater Toledo is working with a broad and diverse coalition, and what you can do to work with the United Way in your own community. We'll then open up to some Q&A, and finally we'll close with some ways to stay connected with us here at County Health Rankings and Roadmaps. On your pre-registration questions, we believe that the goals that we've set here for today will get at much of what you told us you were interested in learning about during our webinar. By the end of this webinar, we're hoping that you will understand United Way's model for community change, that you'll understand why it's critical to focus partners on policy and systems change, and that you'll understand how to build common ground with different sectors. And finally, that you'll understand how to work with United Way and other nonprofits in your community to build broad and diverse partnerships. So now we're going to put up a quick poll to see where you are with partnering with United Way in your community. We call these our rapid response polls, so you can take a moment and let us know where you're at on this question, and then we'll quickly talk about what we see in the results. All right, so we have most of you voting, and we'll give it just a moment more, and then we'll close the poll and take a look at what you have to say. All right. Thank you so much for participating in this poll. We're going to take a look at the results here. Excuse me. So we can see that most of you are kind of spread throughout that partnership spectrum, working on networking, coordinating, collaborating. A few of you are still feeling like you're in isolated silos in parallel play. And so, you know, I think that this is pretty normal for what we see on our webinars, that folks are kind of all over the board, and you're not alone wherever you are in your community. And hopefully this webinar will help you keep moving toward that collaboration stage of partnership. All right, thank you again for participating in that poll. Today's webinar focuses on this essential question: how can we build broad and diverse partnerships that work in new ways to move policy, systems, and environmental change forward? As we go along, please consider sharing with us using that chat box, question box area on the control panel what you are doing to build effective partnerships. How are you working with your United Ways or local nonprofits in your area? What's working for you? We find that these webinars end up being a place where people can connect with and learn from each other. So in addition to learning from guest presenters, we love to share your experiences. So please feel free to comment in the chat box.
So now we're going to provide a brief overview of the Rankings and Roadmaps program, and we know that many of you are very familiar with that, so please feel free to pursue the links that Karen will be posting if you already know this part of our webinars. And we will make this brief, but it's an important part of understanding the context for our presentation today. Many of you are familiar with this. This is the logic model that explains why we are creating rankings. Our goal is to create a healthier nation, county by county, and we do it by ranking the health of every county in every state. It gets people's attention. That's the main reason, so that people will take action. We keep the number of measures small, just 30, and they're ones that every county uses, ones that already exist. And we release the rankings every year. This was our 4th year, which in turn attracts media attention, which gives you, as community leaders, leverage and an opportunity to use the attention from the rankings to further engage your communities in action that will improve health. So if we keep going here, you'll see that for every county there's 2 rankings, and one's for health outcomes and one for health factors, because really we want to convey 2 different sets of messages. One, how healthy a county currently is, so a county's health today, and 2, how healthy a county might be in the future based on the many factors that influence health. So that's tomorrow's health or the county's potential. So there are 2 rankings that we release every year. This is probably the most important slide that we share. It's the model underpinning county health rankings. The main message is that health is the result of a lot more than visiting a doctor's office. That's important, it's necessary, but it's not sufficient. Health is about where you live, learn, work, and play. So starting from the bottom, we know that effective local, state, and federal policies and programs can improve a whole variety of factors that in turn shape the health of communities. And many health factors shape the community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And each of these factors has a different amount of impact on health outcomes. For example, social and economic factors, which include education, contribute as much as 40% to how healthy a community is. So finally, at the top of the model is health outcomes, which we measure as how long people live and how healthy people feel. And I just want to flag that Kate Sommerfeld is going to reference this later. It's such a useful model for talking with all the organizations and community leaders in your communities, and she'll be coming back to this particular graphic. So here's the home page for rankings, and if you click on, there's a little tab on the right side for roadmaps. And when you click on that tab, you'll find the Action Center. And when you click on the Action Center, you'll see that we have a site that provides a whole variety of tools and guidance to assist communities in taking action, including What Works for Health, which is a database of close to 200 evidence-informed policies and programs to choose from. In What Works for Health, we rate the evidence for policies and programs that can affect health, and we also provide examples of communities that have implemented these strategies, along with links to toolkits and other items to help you get started. If you're familiar with CDC, there are CDC strategies in there. There are also strategies in there from other sources. So we want to make it easy for you, a sort of one-stop shop to find what you need to improve community health. And last but not least, I'd like to mention us, community coaches. Thanks to the support of the Robert Wood Johnson Foundation, there are 3 of us, and our assistance is at no cost to you. We're available to consult with you on how to best move action forward in your community, wherever you're at. So we would like to do another quick poll to find out which parts of our site you've used. And Karen is going to launch that right now. Another rapid response poll. And thank you for participating in this. I'll give you another couple of moments here.
This poll is kind of a nice reminder for folks that if you haven't taken a look at our Action Center guides and tools or What Works for Health, the County Health Calculator, those are great resources that you can find links to on our website, as Jen just walked us through. And then contacting us. You know, if you are in a position that you have some questions about how to find the best tools for your community, reaching out to us is a great way to navigate to what might work best for you.
Mm-hmm. Okay, great.
All right.
So everybody can see that?
No problem. Close it and share it.
Yeah.
All right.
All right. Super. And we'll just mention that we just launched our team coaching program, and the applications are due today. But even if you didn't get an application in today, or perhaps you feel like you're not ready yet for team coaching, please feel free to give us a call. We're here to help. You can contact us through the website. Let us know in the chat box even if you'd like a follow-up call. So that's our role, is to help all of you. And it's a real pleasure and a delight to do that. So let's close the poll out. And what I'd like to do now is to introduce Kate Sommerfeld, who is the Area Director with United Way of Greater Toledo. Welcome, Kate.
Hi, Jan and Karen. Hi to the rest of the listeners. Thank you so much for the opportunity today to talk a little bit about both United Ways and other nonprofits in your community. And before I get started, I want to send a special hello or a special shout out to local United Ways and my colleagues across the country, and also at United Way Worldwide, who I know are on the call. As I'm going through this, if there's any brilliant insight or wisdom that you guys want to provide, feel free to jump in. I'm just one local United Way, but really I'm looking for you guys to help drive this discussion.
That's great. Yeah, we're looking forward to hearing from you folks. So feel free to make this very interactive, all of you. And those of you that are not in the United Way, I want to encourage you, if you have things that you want to share along the way about what's working for you, please do that. So, Kate, United Ways have been undergoing some really big changes nationally, and we know that Toledo has led the way. Can you tell us about how you've rethought your role in the community and why?
Yeah, so over the past few years, United Ways across the country and as a network have really been evolving to meet growing community needs. There are big community issues in every local area, issues like disparity in school readiness, lack of affordable housing, obesity, and poverty still are really pervasive and in some cases are actually increasing. And so United Way has begun to really focus on identifying and addressing the root causes of these issues and then mobilizing a local community toward that common goal. We've also begun to focus more on policy and system change, which is different than a typical United Way, who is very focused on programming. And we did this because we've really begun to realize that individuals and families do not live in a vacuum, right? Children and families are embedded in a series of community environments, including organizations, neighborhoods, personal networks, and systems that either touch children's lives directly or indirectly. And many of these issues are so complex. You know, it's been an ongoing learning process for us, but we have realized that it will take an entire community coming together to solve these big community issues. And often United Way is starting to act more in a convener or coalition building role. And so we're working to engage not only other nonprofit partners, public health organizations, businesses, but also really trying to mobilize and activate grassroots individuals, neighborhoods, and networks, those individuals that are directly impacted by the issues we're trying to solve. And so for us, FSG's collective impact model has been a key influence in how our network thinks about partnership and change. I know we'll be providing a link to that at some point, but again, that's a great reference. It's FSG's collective impact model. And so while we're going to focus mostly on United Way during this webinar, much of the foundation and the principles that we'll talk about can be used to approach and engage other nonprofits in your local community. So just keep that in mind as we kind of jump forward. So our mission and value proposition really says it best. Our goal and mission is to mobilize the caring power of community around the world to advance the common good. We're truly about people's lives becoming better, and by doing that, by having local communities called to action against critical issues. And then to galvanize and connect a diverse set of individuals and institutions, mobilizing resources to create long-term change. You know, United Way is in a unique position in the middle of the private, nonprofit, and public sectors to bring both institutions together to solve problems, but also to help the public be activated against those issues as well. And so we're expanding on our traditional work of going into workplaces, gathering and distributing resources, raising money in the workplace campaign, to really becoming a driver of community change, and going beyond simply allocating dollars to nonprofit agencies to beginning to focus on community impact by using a whole set of strategies to change the way community actually works. And again, through shaping systems and organizations and networks to really drive that long-lasting change. So similar to the county health rankings and roadmaps approach that you heard Jan talk about earlier, as a network, United Way is taking a really holistic approach to change population health. As a network, we're focused on 3 key areas in the space of education, income, and health. And these areas are interconnected and they're intertwined. By improving education for all children, we're setting them on the path to high school graduation and college success. And those children who go on to hold skilled jobs will be financially equipped to support their families. And as you all know, it's clear that good health is directly linked to a successful life. And so to remove any one of these 3 building blocks is to topple the other 2. And so as a focus, we're really trying to rally around these 3 community issues. And then this gets us to our end result, our framework for advancing the common good by creating opportunities for a good life. For most local United Ways and as a network, health really is our newest area, and there's a lot of opportunity for us to grow and partner in this space, which is part of the reason why I'm so excited to have this webinar. There are 1,200 local United Ways throughout the country, and each one is unique. It's governed by their own board, and for each of these 3 issue areas, there are research-based strategies that local United Ways are driving in creating specific partnerships and strategies, not only using dollars, as I mentioned earlier, but also really trying to encourage and facilitate both volunteerism and advocacy, which are new spaces for us as well. And as I mentioned before, we're not experts in the health area, but we do have a lot of experience and expertise in convening and partnering and building coalitions to create community system change.
Kate, you've done such a great job of painting this broad picture, this vision of how United Way is really shifting the paradigm. And I'm really curious about how you began the process of moving toward this new way of thinking in Toledo. What did that look like?
Yeah, so this probably looks and sounds different than the United Way you may be familiar with. Traditionally, as I mentioned, United Way has worked to improve lives by raising money. And while this is still really important work and very much needed, many of you are in the nonprofit or government space, and we know how much dollars really impact. United Way has really come to understand that it's not enough, right? That dollars aren't enough individually and solely to address the pressing issues that are confronted by our local communities. And so we realize that some of the programs United Ways have funded in the past are important and valuable, just like the dollars are, but they're only one piece of this broader community level approach that should be in place. And so our new way of thinking really focuses on mobilizing a community's assets. So for instance, people's time, talent, relationships, expertise, technology, financial assets, and other resources. And it also focuses on really improving lives of not only program clients or individuals, but taking that community-based approach, so focusing on groups of people in our community. And for this is what we call community impact. And in Toledo locally, we really had an aha moment in 2010 when our county health rankings and this framework was released. So for Toledo as part of Lucas County, and we came out being ranked as 72 out of 88 counties in health. And so it was incredibly alarming for us, and it really created a sense of urgency in our community to mobilize. And so once we got over this initial shock, we began to look at influences of population health. As we looked at this model earlier, it really became a tool in our local community to talk about the impact that social and economic factors have on health. And we actually took this model out to our local community leaders in different sectors, so in education, in employment, in business, to help illustrate why partnership was essential. And then we started to ask, okay, and we're ranked 72 out of 88 counties, but how do we truly begin to move the needle, both on our health issues and our overall community well-being?
Right, so what I'm hearing is the rankings had a big impact in Toledo on your being able to change the conversation. It really shifted it. And is that right?
That's right. That's right. Both the rankings, coming out being ranked as 72 out of 88 is not exactly where you want to be. But we also were provided tools. So here was the rankings. You have a lot of room to grow in this space. But here's also a framework to help engage other sectors and other partners that normally might have not seen themselves as playing a role or being important in the health space. And so having that framework has been a great resource for us.
Right, so they were able to see that model and see where they fit in and how they can all contribute and work together.
Absolutely.
So you've taken a strength-based approach to bringing these partners together, and you've been able to leverage these partnerships to move toward policy and system changes. Can you share an example of that, Kate?
Yeah, absolutely. So understanding the interconnectedness of our three key areas that I talked about before, education, income, and health, our community locally really identified the area of education as a key priority. One of the major initiatives nationally for United Ways and Network, and also here locally in Toledo, is around high school graduation rates in the area of education. So high school graduation rates are a key social and economic determinant of health. You saw them before on the last slide, education as one of those factors. And it's the #1 indicator of both health outcomes and salary earned is educational achievement. And in Toledo, our graduation rates were very poor, and the rates for graduation areas for African American and Latino males was almost less than 50% than their white counterparts. So for our community, improving graduation rates was critical. And really we began to understand that if we could strengthen our graduation rates, that we would see an impact on all indicators of a community success, including our county health rankings. And so for us, working together was no longer just about collaborating on projects. That wasn't enough, but figuring out how action and work across an entire community and many institutions and organizations could be organized and coordinated so that individual actions actually reinforce each other. And that's the FSG, collective impact model. And so really getting to that common vision, a shared set of measurable goals, and evidence-based actions that reinforce one another's work and further those goals. And so earlier we talked a little bit about the education, income, and health. And so to give a specific example of the graduation rates, we can't expect kids to work at optimum capacity if they're dealing with issues like homelessness and hunger and vision and health issues. And so in our health area, we really began to focus on the health-related reasons why kids weren't thriving academically. And so we started to engage partners, schools, parents, and providers around those health issues that were impacting a kid's educational success. And it became very loud and clear for us the need around vision services specifically. Children in our community did not have access to vision care, and the majority of our kids are on Medicaid, but unfortunately most optometrists didn't accept Medicaid. And if they did, they often only provided the exam, but then they would actually send the kids across town to a large supermarket to get their glasses. And so often if the exam did occur, kids didn't actually get their glasses that they needed. And so United Way started convening partners to figure out a solution. The schools were on board, but they weren't sure what services in the community were available. Many nonprofits wanted to help, but didn't necessarily have the leverage to create system-wide change or to access the kids. We also began to engage a group of local private optometrists who were community-minded to help us really think through a strategy. And we landed on our public health department to provide mobile services in schools. In our local community in Toledo, they really are the experts in our community in delivering services to low-income individuals. And they have a large amount of programming capacity, something that our other partners in the community did not have. And so our schools and our school nurses provided both access and coordination within the schools. And so now the result of this, 2 years later, we have our health department serving over 30 schools of our low income within Toledo Public Schools, providing full vision services. An optometrist and a team will go into the school and perform exams on kids who've been identified through a vision screening from the school nurse as being at risk. For the children who do need glasses, kids are pick out their frames that day. They choose which lens and which frame they get. And then the health department actually takes the frames to be processed and the lens to be processed, and then return those lenses and frames to the school within 1 week. And so the kids on site get fitted for school glasses. And then our school nurses provide the follow-up and also communicate to parents. And so United Way in this model and this project really provided the bulk of the startup dollars to purchase the equipment, hire an optometrist, and create a comprehensive plan for all kids in our community to have access to vision services. And in the first year, the health department served over 500 students with eye exams and glasses. And based on this success, United Way was able to help our partnership leverage our corporate community. And so we've had 2 corporations sign on to actually financially support the bulk of this work. And this past year, we saw just under 1,000 students. We had about an 84% rate of kids who were seeing, needing, and receiving glasses. And so really high rates and work from the school nurses actually doing the screenings and identifying which kids actually need the full exams. And for many of our students, this was the first time they ever had had an eye exam. The health department actually, unfortunately, also diagnosed many cases of glaucoma, cataracts, and even some corneal scarring that we saw. A lot of these kids, again, this was the first time they were ever had seen an optometrist. And for us, this wasn't one organization driving the work, but it was really combining resources and staff. And without question, we accomplished more as a collective partnership than we would if one individual organization would have went in and tried to create a solution for this need.
Right, and I'm really struck by how going in together and working on something so specific and having great success leveraged more resources. It wasn't a matter of going to those organizations first and asking for the resources. So you step forward as United Way and moved that along first. And so as we're talking here, I'm wondering, so how about some of the, have there been challenges taking on a leadership role in your community?
Yeah, lots of challenges in partnerships. We have a lot of battle wounds and lessons learned, that's for sure. But I think with most of these big complex issues, probably a lot of the issues you're facing in your local community, there's not a silver bullet. The reality is that the issues are so complex that there's not one organization or institution can change it, but it really will take the entire community all driving toward the same goal. Our schools weren't going to change it. Our corporate sector financially wasn't going to be able to put dollars to change it. But we really feel like if we were to have come together as an entire community, we could have a significant impact. And this model requires coalition building and partnership with multi-sector teams with diverse perspectives. And while we found out that this is important, it's very challenging and it's difficult. Many of you, I'm sure, are in this partnership space, and communication and making sure that you're aligned in expectations is very difficult, but without question for us, we found that it really drives the most change. And one of the challenges, I think, for us is that each sector and organization has a different mission, philosophy, and culture. And, that can be a challenge, understanding how to speak each other's language, understanding what priorities public health versus nonprofit versus the schools have. And it can also be a strength. One of the things that we've learned is that when you have those different perspectives, it really creates a deeper strategy and a deeper solution that's more comprehensive. And so learning to work more effectively with partners is something, as a United Way network, we're still on a journey, we're still learning. And then also I think the other challenge for us is being in this system work, it's very different than our normal work of funding programs. It's a much longer process, and communicating to our donors and community this shift is an ongoing learning process for us. You know, we have been used to historically being able to say we funded X number of dollars and it impacted X number of kids. And we know that policy systems and environmental change is a multi-year, if not more, process. And so results are not always immediate, and that can be challenging. So effectively sharing the work that you've accomplished and the end goal is really critical in providing those intermediate wins. And then also sharing how that partnership, what other impact that partnership had. And so that has been some of our lessons learned and challenges in that space.
Thank you, Kate. I really appreciate that. You've been very proactive in Toledo, but how can communities that are interested in reaching out to their local United Ways and other nonprofits engage them in community health improvement efforts? Many of the questions that came in on the pre-registration had to do with this. If you could talk to that point.
Yeah, this is a great, as I mentioned before, there are 1,200 local United Ways across the country, and while we have a network where we interact, each local United Way is independent. They're governed by their separate board, and so it can be a challenge in this space. I think being aware that we are on this journey to collective impact and collective outcomes is important to know. And if you don't currently have a relationship with your local United Way or another specific nonprofit, I would really start by doing some research and finding out what their focus area is. Most nonprofits in United Way, including, have some type of strategic plan or focus area. Most do some type of planning and needs assessment and come out with their priorities. And based on that, understanding and framing the issue you're working with your United Way is really important. And so even taking the county health rankings model and saying, if you're working on an area such as unemployment, how does unemployment impact education? A lot of United Ways across the country are very focused on education. And so understanding how to frame and to message the interconnectedness of issues, I think, is really important. And then I'd go ahead and just start reaching out and developing relationships. Doing a discovery meeting where you go and simply listen to the interests and passions of the stakeholders first is often a good way. United Ways across the country and nonprofits have a very passionate view of the issues they're dealing with, and so going to just listen. And then identifying where their shared values or goals, so understanding where your local nonprofit is or United Way is and what you're trying to accomplish, and finding common ground in that space. In the issue of community, there's so much overlap in the issues we're all dealing with that there's definitely some shared goals. And especially among public health and nonprofits, there's many of the same issues that we're working on, and sometimes we don't even know that the work that each other are doing in local communities. Then once you've gotten to that space, really starting to look at leveraging resources. So is there similar work happening that staff in each organization are doing? Does one organization have expertise in a particular area that could actually strengthen the other coalition or partnership? And when you start really leveraging strengths and resources, it was when you get to that space of really driving long-term community change.
Thanks so much, Kate. This has really been terrific. So what you're saying is it's listening and finding that common ground by going and actually meeting with one another, maybe sitting down with a cup of coffee and finding out where you have things in common. So I know that you've used some great tools along the way. Could you share with us some of those and how you've used them and what the benefits have been?
Absolutely. Well, I would just reference I would go ahead and just reference the County Health Rankings and Roadmaps website. For us, in the Take Action section, has had so many useful resources and tools. We didn't want to recreate the wheel, and there's limited time, and so on that website there's a lot of resources and tools, including the first 3 bullets. The Power Prism's Effective Coalition Member Recruitment was a great document for us in thinking about who needs to be at the table. Including those non-traditional partners that you might not always think of. We use this in the beginning of our process and planning, but we also often go back and periodically assess who else might need to be included. Is there another perspective that's missing? And then the Coalition Mapping Worksheet. This is a great, simple visual tool to map out the perspectives and positions of partners. We talked earlier about diverse perspectives and values, and this worksheet really helps understand and analyze where individual partners are coming from. You know, not all the partners in a coalition will have the same level of influence and commitment to the issue, and that's okay. But this really helps in thinking about relationships, and again, along with the membership recruitment, it often will shift based on objectives or over time. You'll find some partners that are engaged in specific issues or more engaged over a certain period of time. And then the Prevention Institute's Collaboration Multiplier. This has been a great interactive framework and tool for helping us analyze the collaborative efforts across multiple fields. So it's designed to guide an organization to a better understanding of which partners and how to engage them, identify partner perspectives, and then really begin to leverage expertise and resources. For us, it helped lay the foundation for shared understanding and common ground across all partners. We actually used this tool with our partners and had as a group exercise all of our partners complete the worksheet individually and then came together and had dialogue across the coalition. And then United Way's Charting a Course for Change. This is a framework for the United Way Network for our community impact work. And again, if you're looking to engage your local United Way, either if you maybe haven't had success in the past or you're looking for a new approach, this would be a great document to really get some of the background research on our focus areas. And then obviously we talked about the county health rankings model. Both the model is how we illustrated to our non-health partners why you should care about health. But then, as I mentioned again, also the Take Action section has both planning and practical tools, including an MOU that we used in our coalition.
Thank you so much, Kate. Yeah, and Karen is actually chatting all of the links out so that people can connect to these resources and tools. And again, I'll just put a plug in for contacting us as community coaches. If anybody needs some help with the tools and navigating through the site, please feel free to contact us. So in sort of looking back, Kate, what lessons have you learned along the way that perhaps other United Ways and nonprofit leaders might use? You've certainly had a lot of experience, so if you could share what some of your thoughts are there, I think that would be very helpful for everybody.
Yeah, I think the most important lesson that we've learned over this journey, probably over the last 3 years, is the engagement of community. Often as United Way, you know, we sit in our offices and we look at data and we analyze data, and we don't talk to the people who are impacted. And so for us, it's really been necessary to do community engagement, to get out of our office, to talk to those people who are actually in poverty, who are experiencing those things. You know, if we would have never engaged parents, we probably would not have heard and learned of the issues around vision services. But it was only by going out to the schools, to talking to school nurses, to talking to parents. And often people in community really know the strategies, the right strategies. And so engaging them in the work really gets not only their buy-in, but helps deepen the strategies. The other thing that we've learned is around social media and non-traditional media. And part of the challenge in the policy systems and environmental change space is really messaging and communicating. Again, because it's such a long-term process, understanding and sharing quick wins, easy wins, intermediate wins is really important to sustaining partnerships. And you know, for us, we've really used it as a tool to both engage local grassroots community, but also to show our partners who are in the coalition the value of their participation, but then also to engage other partners who are outside of the work to say, wow, look at all the great stuff that's happening here. You should be a part of it, or don't you want to be a part of it? And then also framing our message to donors. I think, again, going back to this policy systems and environmental change, for us in the United Way Network, this is such different work. And really understanding how you frame messaging to donors to talk about that community level change, to talk about the impact that system-wide change has on large groups of people has really been a key and something, again, that we're continuing to get better at. And then probably the one that hits closest to home for me is be okay with the chaos. You know, this partnership and coalition building can be chaotic, it can be messy, and that's okay. There's real value in building partnerships and building relationships with people in multiple sectors. And there is a level of chaos in this space, and just be okay with it and know that it's probably going to forever be there. And then again, as I talked a little bit about in the first of this slide, you know, getting out of your office and building relationships with not only the people you would normally think about, you know, your elected officials, your business leaders, but knowing the lady who does the block watch down the street, building that rapport and that relationship with those key individuals, knowing the parent-teacher networks and those things have been huge for us. Again, getting out of the office, not just sitting in and analyzing data, but really building relationships.
Kate, this has been fantastic. Thank you so much for sharing your expertise with us. And we have had some questions from folks. So if you're ready, we would love to open it up to Q&A right now.
I would love to, and I would again just put a plug. Any of my colleagues in the United Way Network, feel free to jump in, or United Way Worldwide, feel free to jump in and to answer any questions as well.
Great. Thanks so much. Well, here's a question, and I'll bet a lot of folks have this same question. How can we move beyond funding programs? And there's sometimes, you know, they're dependent on United Way funds. How can we move to a broader-based action for change? You know, when we have such a program mentality and you know, everybody is fighting for that dollar that they've gotten every year or, you know, want to get again the next year, how do we move from that into a broader vision where we can all share responsibility?
Yeah, so I think understanding the impact that this policy systems and environmental change can actually have is really important. You know, individual programs are great and they serve in a much needed way, but they're only one piece. And so I think as communities really start to understand taking their community work to the next level, what would it take to change systems? What would it take to actually change the way a community works is really important. And there are actually a lot of foundations across the country and locally that understand this new approach. I would also just put a plug into your local community foundation. A lot of the community foundations have specific grants in this space. And I think, again, understanding the potential impact that this larger work happens. We have taken the shift in our local United Way and have actually been funding things like advocacy and policy change. But again, this is a new space for most United Ways. There's many United Ways that continue to fund programs, and that's just a journey. I think, again, it's understanding for United Ways, having your board really get this shift. We had some great tools from the County Health Rankings and Roadmaps project and from Robert Wood Johnson that we were able to use to help our board think about policy systems and environmental change, and again, that shift. And so that was a huge win for us. I would definitely recommend that understanding that philosophical shift between programs and policy change.
So Kate, we have a question also that really relates to what you're just saying. Have you shifted entirely to funding policy and systems change work, or do you still fund some programs in your community?
Yeah, we absolutely still fund programs. So there is a level of our funding that goes, again, to those specific programs, everything from basic needs to providing services for primary care. And we think that's important and that's critical. I think for us, our local United Way will continue funding that, but we also understand that there's another level of community that we have to start impacting. And so I would say we probably have, at this point, it's probably a 70-30 split. 70% of our funding still goes to programs, but there's about 30% that is in this advocacy, this community engagement, this policy change. And our board has ongoing conversations about what's the split. We also have the conversation around basic needs versus more a proactive upstream approach. And I think it's a challenge, but as a United Way network, we have to get to this space where we're thinking about changing systems and community if we're truly going to see county health rankings move in local communities.
So another follow-up question, Kate, is whether the money, well, so you raise money and, you know, in collective impact we talk about a backbone organization. Do you in Toledo fund another agency or a series of agencies to be that backbone, or do do you use the money internally to become the backbone yourselves?
Yeah, that's a great question, and we do both depending on the issue area. So for us, for example, in the space of health, we have a phenomenal partnership with our YMCA. In the health area, it was really apparent to us that the Ys had a history of doing health work and programming, and so we actually funded our YMCA to be our backbone organization for one of our partnerships called Live Well of Greater Toledo. United Way provides the dollars and the funding, but the staff is actually housed at the YMCA. For another initiative in our education space, there wasn't another community partner that was really driving this work, and so we had a lot of dialogue and a lot of conversation with community leaders, and we're really to the space of there was not another organization to be that backbone entity, and so United Way in Toledo became that. Our end goal is that we find organizations that have the right strengths in the right space, and so if there's another organization, again, I mentioned the YMCA, who does great work in the space of health, we want to make sure that we're providing support and capacity to them. And so we do both, depending on the issue area and depending really on the readiness of our community and the capacity of our partners.
Kate, I know you talked during your presentation a little bit about your relationship with the funders and how you communicate with them about this shift. Can you just talk about that a little bit more, about how have you changed your campaigns or how you work with your funders as you've moved some of your funding, your work into systems and policy change? Seems like there'd be some messaging work to do there.
Absolutely. And I think we started really when we first identified the issue of vision services as being a gap in our community. Right off the bat, we started engaging our corporate sectors. We weren't sure exactly what it would look like and what the end result would be, but for us, it's really important that both donors on a corporate level, but also individuals in our community really are part of creating the solution. You get more buy-in when people are on the ground helping you create. And so right off the bat, two of our corporations, one of our health systems, and then actually a bank for us, as we started identifying this issue, we started having the conversation, right? In the end, we knew in the back of our head that money would probably need to be there, and we would want some type of sponsorship. And so at the very beginning, we started having those conversations. Again, it ended up resulting in both of those two organizations ended up supporting in year 2. And financially supporting almost the entire program. And again, so when you're identifying issues from the beginning, if you're able to engage corporations and partnerships in the dialogue, they have a vested interest in that space. And then we also did start to message differently. We have a great marketing team here in Toledo, and really understanding that longer-term shift. We shifted a lot of our communication and dialogue to talk about the entire community. What would it take to make the entire community better? Historically and previously, a lot of our messaging was around individuals. So this program served 500 people, or this is one person's story. And so we really started to make the shift in our communication and our messaging to talk about the broader community. We started talking about the county health rankings, what that meant as an entire community, and then again, what would it take to truly change the way our systems and our community worked. And that's a slow process. We still have some of the individual programming messaging filtered in with some of that system change. We didn't make a complete shift, but we definitely slowly over the past 3 years have been incorporating that system change message. And a lot of our donors have responded well to it. They see the impact that changing systems and policy has. I think they are excited about it. And so, again, it's still a mix for us, both funding program and policy, but we have a lot of donors and corporations who have responded really positively and are excited about that shift in thinking.
Great. Thank you, Kate. So we have a question about partnering to improve health outcomes, not just in like an urban area, but how do you partner to have an impact in your outlying communities?
Yeah, well, that's a little bit ironic that you ask. I recently just shifted down to a rural community. So I went from working full-time in Toledo to being in a very agricultural community, and it's definitely a different landscape. A lot of lessons learned, but I think some of the key threads in there are still around partnership and collaboration. One of the things I found working in rural communities is sometimes the lack of awareness of services and programs. You know, there are some great things that are happening, but because you're in more of an isolated area, sometimes either individuals aren't aware that services and programs exist, or they're not able to access those. Transportation might be an issue. And so really beginning that dialogue around community partners, you know, your kind of traditional government entities, public health, businesses and schools, to talk about what could we do in our community. As I mentioned, each local United Way is independent and has their own strategies, and there are great examples of local United Ways across the country in rural spaces and rural areas that are leveraging voice and dollars and resources. And I think the other thing that I would say is an asset for rural communities is that there's a sense of community in some of these areas. You know, often you run into each other at the grocery store, you have relationships with your county commissioners, and sometimes some of these partnerships and collaborations actually work more efficiently because there's that small town. But again, it goes back to relationship building, communication, and then making sure you're engaging local residents in those strategies. So if you have a rural community, making sure you're pulling from diverse populations to help really create strategies that make sense. The last thing we want to do is take this cookie cutter approach because we know communities are so different. And so really understanding your local community, what are your strengths, what are your opportunities for improvement, and then engaging local residents in creating that strategy.
Thanks, Kate. Here's another question that gets at, it would address both working in urban and rural. It's a question of hats. So how do you communicate, or do you need to communicate when you're playing a role as United Way, as a convener and a connector and collaborator versus carrying out programmatic ideas? And I'm wondering, as you were just talking about the rural, are there different, actually, expectations in a rural setting where maybe there aren't as many resources, so there's more pressure on a United Way person or staff to be doing more programmatic work?
Yeah, that's a great question. We definitely wear many hats within local United Ways. I think even in terms of funder, that can be an intimidating space. And so when you're coming together with your local United Way, are they wearing their funder hat? And there can be a level of hesitancy to really reveal some of the true issues that are happening. And so that can definitely be a challenge. There's also local United Ways across the country that have started in this programming space. Some United Ways, for a variety of reasons, have started hiring staff to do their own programming, and that can create a sense of competition, and so that's difficult to deal with and something we have to navigate as well. There are, without question, multiple hats we wear. I think understanding your staff, your local United Way staff person, building that relationship. One of the assets that United Way staff often bring to the table is in that relationship and that convening space. And so again, communicating well with your local United Way person, understanding where they're coming from, which hat they're wearing from. From a lot of local United Ways there, and this is not the case in rural communities, but in most larger United Ways, there are multiple staff people. So there might be a programming staff person, there might be someone who's reviewing the allocations and the evaluation, and often it's knowing which right United Way staff person should be at the table at that point. And again, that's relationship building with the CEO, with your board, and really understanding in that space.
Thank you so much, Kate. We have one last question before we wrap up for today. You've talked a lot about the partners that you've brought to the table and the work that you've been able to accomplish. But once you get these partners to the table and you start getting them engaged, how do you sustain those partnerships? How do you keep it going, keep people motivated?
Yeah, so a lot of it goes back to that messaging and communicating piece. Making sure you're sharing your wins, your early wins, especially if you're doing this long-term policy system change work. Sharing your wins with not only the partners, helping them understand the value that has been created by them sitting at the table. There's often a lot of staff time that's spent on coalitions and partnerships, and often, your boss, your CEO might be asking, well, why is the staff person spending so much time there? But if you can start to message and communicate and share those wins, both internally within your coalition And then probably more importantly, externally with your community. You know, we all want to be part of something that is changing the community, that's improving outcomes. And the more that you're able to message and share that outside your partnership with the broader community, I think you'll get a sense that communities really start to feel vested in that. And then also in terms of aligning resources and staff, one of the really neat things that we've been able to do is to leverage a wide variety of grants. And you know, while we try to get away from the money piece, it still is important. And it's important for local nonprofits and for public health as well. And so really showing if you get some wins in terms of grant resources, additional dollars, or even if it's not dollars in terms of expertise is another really good win that will help partners stay engaged, see that there's value in that. And then ultimately I think you also have to make sure you're responsive. If there's partners at the table that are saying, well, this is not a good use of my time, then maybe you need to reassess the partnership, or maybe you need some new partners. And so really being willing to look internally at yourself, at your own operating, and doing some assessment is also important.
Kate, this has been so helpful. I feel like we could keep going and keep digging deeper into this and learn so much more, but we're going to have to wrap up now. I want to thank you very much. And as we wrap this up, I'll just remind everybody where we started with the webinar. We focused on the essential question of how can we build broad and diverse partnerships that work in new ways to move policy, system, and environmental change forward. And we hope you're leaving with some great ideas and some even specific ways that you can do this. And Kate, you've been terrific with providing those to us. There are some ways to stay in touch with us, and they include following our County by County blog and following us on Twitter and liking us on Facebook, and of course subscribing to our e-newsletter, which probably most folks on the webinar are on the e-newsletter and heard about us and heard about the webinars through that. So we would just like to end with this quote from Ralph Waldo Emerson, and again, Kate, to thank you so very much for your time and sharing your experience on this webinar. And
thank you for having me.
Thank you. And we invite the rest of you to come and visit our Take Action Center and give us a call, give us an email. We look forward to seeing you on future webinars. And thank you again, Kate.